Bernard-Soulier disease is a platelet adhesion disorder caused by a defect in the GP1B receptor. This interferes with the correct binding of platelets with the VWF and blocks formation of the platelet plug. Today, in this mnemonic video, we'll be jumping into the countryside and covering all the necessary facts you need to know about Bernard-Soulier disease so you'll be ready come test day. First, let's check out the location of our scene, which seems to be a big barn. Notice the large sign indicating there's a barn sale going on? I sure do love a good old country barn sale. This barn sale will serve as your memory anchor to Bernard-Soulier disease, since barn sale sounds kind of like burn soul or Bernard-Soulier, right? Of course, we need to dive a little deeper into our scene to really understand what causes Bernard-Soulier disease. Let's take a look at the car wreck. It must have been bad because even the GPS is broken. Even though the screen is cracked, I can still see that the crash must have happened only 1 block away from the barn sale. This broken GPS showing 1 block away represents a defect in GP1B receptors, the cause of Bernard-Soulier syndrome. You know, GPS for GP and 1 block for 1B. Put this together and you get GP1B. GP1B receptors are glycoproteins on the surface of platelets. These receptors mediate proper platelet adhesion to vessel surfaces as well as other platelets in response to vessel injury. Let's discuss exactly how this works in our following symbol. Now, let's pan over to all those fancy antique platters. Someone must have bought them at the barn sale, however, it seems like they aren't sticking in the car. Also notice how this isn't any ordinary car, it's a Volkswagen or VW car. Plates happen to be our recurring symbol for platelets, and VW cars represent von Willebrand factor, or VWF. Therefore, these plates not sticking to the VW car should help you remember impaired platelet adhesion to VWF. To review, von Willebrand factor is expressed on the surface of damaged vessels. VWF is actually the thing that GP1B binds to in order to cause platelet adhesion and aggregation. In Bernard-Soulier disease, a defective GP1B causes impaired platelet adhesion to the vessel wall. If you've seen our video on platelet plug formation, you'd know that this blocks the downstream formation of a platelet plug, which obviously impairs our ability to stop bleeding. It does seem that they had too small of a car to really fit these plates in the truck. I mean, this VW buggy really is a super small automobile. This small auto should help you remember that Bernard-Soulier disease is inherited in an autosomal recessive pattern. Auto for autosomal, and this is a small or recessive auto, definitely not a dominant one. This autosomal recessive inheritance pattern means that Bernard-Soulier disease is a relatively rare disease. After all, it requires 2 mutated genes, one from each parent, in order to cause disease. But how does Bernard-Soulier disease present clinically? Turn your attention to the person who crashed this car. He seems to be bleeding a lot. Maybe he hit his head or something. This bleeding should be an obvious result of the impaired platelet aggregation that we covered earlier. Symptoms usually include mucosal bleeding like gingival bleeding and recurrent nosebleeds, as well as microhemorrhages such as petechiae seen on the skin. So now that we know the clinical presentation, let's cover some laboratory findings. It seems that the driver must have crashed due to all the beer he has been drinking. He's even gotten some of this yellow liquid all over his receipt, ruining it. This ruined receipt should help you remember that Bernard-Soulier disease can be diagnosed through an autosomal ristocetin test. Since ristocetin sounds kind of like receipt, and this receipt is ruined, indicating that it is abnormal, right? For context, ristocetin is a lab substance that forcibly activates VWF to bind with GP1B. In normal patients, the presence of both VWF and GP1B means that ristocetin will cause platelet aggregation. However, in Bernard-Soulier disease, an abnormal ristocetin test is seen since there is no GP1B to bind to VWF. Regardless of how much ristocetin you add, the platelet aggregation will not happen. Notice how the car crash victim is trying to return his receipt, maybe to get his money back for the broken plates. But the barn sale worker obviously cannot take the receipt back after it's been ruined with this yellow liquid. This receipt that cannot be returned or corrected should help you remember that in Bernard-Soulier disease, ristocetin does not correct with addition of normal plasma. That is, ristocetin, like our receipt, cannot be returned to its normal state through the addition of plasma from normal people, since plasma is the yellow liquidy component of blood without cells, right? To understand why this is, know that normal plasma contains VWF but does not contain platelets nor GP1B. So the addition of normal plasma cannot fix the underlying problem here, the lack of GP1B. Contrast this against von Willebrand's disease, another disease where the issue is a deficiency of VWF levels. In von Willebrand's disease, the baseline ristocetin test is abnormal, but the test does correct with addition of normal plasma, since normal plasma replenishes the VWF that was missing. This difference is very important to remember for your exam. Now notice how the car crash victim is bleeding all over his fancy watch. While I can't see what time it is, I can tell you it's time to see a doctor. This bleeding on his watch should help you remember that Bernard-Soulier disease increases bleeding time. Bleeding time, or BT for short, is a laboratory measure of the time needed to form a platelet plug. In other words, bleeding time measures the function of primary hemostasis. Increased bleeding time is seen in Bernard-Soulier disease since platelet adhesion and aggregation is impaired. This shouldn't be too surprising, so let's just move on. Now, let's shift our gaze back to the plates in this man's Volkswagen. While the car is small, those plates are still giant. Of course you buy giant serving plates like this at a barn sale. These giant plates should help you remember that patients who have Bernard-Soulier disease have giant platelets on peripheral blood smears. Giant platelets are a characteristic diagnostic feature of Bernard-Soulier disease. This is thought to occur because GP1b defects cause abnormalities in the cytoskeleton of megakaryocytes, which are the precursor to platelets. All you need to remember is the end result. These platelets are big. That's about it for this mnemonic. Let's take a moment to recap. Bernard-Soulier disease is an autosomal recessive platelet disorder caused by a defect in the GP1b receptor on platelets. A defect in GP1b prevents platelet adhesion to von Willebrand factor, or VWF, which impairs platelet aggregation into a platelet plug. Clinically, patients present with bleeding, with mucosal bleeding from their gums, petechiae, and recurrent nosebleeds, also known as epistaxis. On laboratory testing, patients will have an abnormal ristocetin test signifying a defect in the binding of GP1b to VWF. Notably, this ristocetin test does not correct with the addition of normal plasma, since normal plasma replenishes VWF but does not contain any GP1b. Other laboratory results include an increased bleeding time, which signifies increased time needing to form a platelet plug. Peripheral blood smears will reveal giant platelets. And now we're actually done with Bernard-Soulier disease. I'm going to go check out this barn sale myself to see if I can't nab something nice. See you in the next one.